degenerative brain disorder characterized by rapidly progressive dementia. To make matters even worse for those with it, mortality rate is 100% in under a year.
Creutzfeldt-Jakob's disease is a degenerative brain disorder characterized by rapidly progressive dementia. At first, those with CJD experience coordination problems, personality changes, impaired memory, thinking, judgment, and vision issues. Insomnia, depression, or unusual sensations often develop as well. The leading theory is that CJD is caused by abnormal versions of the prion protein. When prion proteins become misshapen, they become infectious and can harm normal biological processes by spreading to other cells in a chain reaction. When enough appear, the abnormal proteins clump together and lead to neuron loss and other brain damage. CJD affects an estimated 1 person per million and develops later in life, typically around the age of 60. 90% of individuals with CJD die within a year. There are 3 types of CJD: sporadic, hereditary, and acquired. Sporadic accounts for over 85% of cases and appears in individuals with no known risk factors. Hereditary accounts for 10% of cases. In order for one to develop hereditary CJD, the person must have a family history of the disease and test positive for prion mutation. Acquired CJD accounts for less than 1% of cases. It's transmitted by exposure to brain or nervous system tissue through certain medical procedures, such as grafts of tissue that cover the brain or receiving human growth hormone taken from human pituitary glands. Interestingly enough, a number of years ago, several cases of CJD in Britain were attributed to contaminated beef. Though at this time it is impossible to determine if eating contaminated beef would be a cause of CJD, medical professionals are skeptical.
Creutzfeldt-Jakob disease has many neurological and psychological symptoms, including dementia, anxiety, depression, memory loss, troubles thinking, swallowing, speaking, and balancing. Their death usually comes from heart failure, respiratory failure, pneumonia, and other infections throughout the body. Many treatments have been tried for patients with CJD, but nothing has been successful, so a lot has been focused on treating managing their symptoms for the time that they are still living. People affected by CJD vary depending on the type of CJD they have. With sporadic CJD, it tends to develop later in life, usually around 6 years old, and their death comes quickly within a few months or even weeks. Genetic CJD occurs slightly earlier in life but has a bit of a longer lifespan. Variant CJD has affected people much younger, such as in their 20s and 30s. While it has a longer lifespan, it also has more neurological conditions, but they can live up to 2 years after they're diagnosed.